we start looking at a CT scan, it's important to review some relevant anatomy of the mandible. Although we will review some basic anatomy at the beginning of each module, it is expected for this course that you already have a thorough knowledge of facial anatomy. When it comes to looking at a CT scan, this knowledge of anatomy is paramount so that when you identify a fracture or identify normal anatomy, you know what you're looking at. When it comes to the mandible, looking at it from an anterior-posterior view or a sagittal view, you can begin to see the different parts that we'll be looking at. Here we have our symphyseal region and a symphyseal fracture. Here we have our parasymphyseal region on each side, our mental foramen where the inferior alveolar nerve exits and becomes the mental nerve. We have our body of the mandible, and as we can see here, a body fracture. This comes to the angle of the mandible, and then heading up the mandible we have the ramus, the coronoid process, the condylar process, and the condyle. Also, don't forget we have the alveolar segment, which houses all the teeth of the mandible. These are the areas that we'll be looking at on the CT scan, so it's important that you are aware of where they are and where these fractures can occur. The best thing you can do throughout this course is to obtain a plastic skull or model of the entire face and reference it whenever looking at a CT scan or identifying a fracture. This will help you visualize the skull in 3 dimensions, and there should be one available at your hospital or residency department. The first area of the face we're going to look at is the mandible. The mandible is arguably the most important structure to identify properly on a CT facial bones, as it is the majority of fractures we see as oral and maxillofacial surgery residents. At McGill, we operate with a trauma team and cover full facial trauma, but at some institutions, mandibular trauma is the bread and butter of your rotation. Starting once again from the bottom of the patient's face, scrolling upwards, you should see the inferior border of the mandible. Now, as we've discussed in a previous video, it's very important right away to switch to our bone window. You can see how much easier it becomes to visualize the bones of the face. Now, as far as basic structures go, whenever looking at a bone, such as the mandible, you can see a thick, radiopaque white line on each side with a more radiolucent center. This represents our outer cortex and our inner cortex of the mandible, as well as the cancellous bone inside. The cortices in particular are extremely important, as they are the easiest to follow for breaks in them to see for possible fractures. Indeed, in a normal mandible, you should have smooth running cortices without any breaks in them. Although there are a few exceptions such as suture lines, we'll cover those at a later time. Now, starting from the inferior border of the mandible and scrolling upwards, i.e. towards the top of the patient's face, one of the first structures you'll see is the roots of the mandibular teeth. These are the cross sections of the mandibular teeth that you can begin to see in the axial view. And as you scroll up, you'll notice there's an overlapping point here. This is the point of the scan where it's no longer viewing the mandibular teeth and now it's transitioning to the maxillary teeth. If we were to keep scrolling, you would see we're now in the maxilla, with the mandible being here posteriorly on both sides. So it's very important when starting at the bottom of the scan and scrolling upwards, as soon as you see this overlap, you don't get tricked into following the maxilla and you continue to follow the mandible. When you start out, it's easy to see all of the mandible at once. Indeed, as I'm scrolling up, I'm looking at both cortices on both sides for all of the mandible. But you'll notice once you scroll up and meet that junction of the mandible and the maxilla, it begins to become difficult to see all the mandible and look at all the cortices at once. This is why I highly recommend splitting your view into one side at a time, with this side being the right side of the patient and this side being the left side of the patient. So, starting from the bottom, we're looking at the cortices. We don't see any obvious breaks. It seems to be smooth everywhere. We're beginning to see the roots of the teeth. We keep scrolling up. Now, we see that break where it's transitioning to the maxilla, so now I'm only focusing on this side. This is the right body of the mandible trending towards the angle area, and I'm still looking for any breaks in the cortices or anything that seems to be out of order. So as we continue to scroll up on the right side, we've passed our angle and now we're going up the ascending ramus. we begin to see this large defect here on the lingual side of the mandible. This represents the lingular area where the inferior alveolar nerve is entering into the mandible. And if you scroll down, you can actually follow the nerve, go throughout the mandible, going more and more anterior and exiting via the mental foramen, as you can see it right here. This is a common beginner's mistake when looking at CT scans, thinking there might be pathology or a fracture here through the outer cortex. But as you can see on both sides, this is just the mental foramen and the inferior alveolar nerve exiting through these foramen. So, scrolling up, we're in the ascending ramus. We see our lingula and inferior alveolar nerve entering the mandible, and we keep scrolling upwards until we get to this point. This point where it breaks represents the sigmoid notch between our coronoid and our condyle. It's important to scroll up and look at the coronoid first, going all the way up until it disappears, making sure there's no breaks in the cortices or displaced fragments. Then I would return to the sigmoid notch and scroll up once again, looking at only the condylar area. As we can see, our condyle widens out into the fossa and then it disappears. It's crucial to keep scrolling until the entire structure disappears to make sure you visualize all of it. Indeed, sometimes if you were only scrolled to this level, you may miss a fracture that's more intercapsular and higher up in this area. So now that I've done the right side of the patient, I would scroll all the way back down and look at only the left side of the patient. So scrolling through, we're going to the body towards the angle area, going up the ascending ramus, we see our lingula and inferior alveolar nerve entering there. Keep scrolling up, we see the sigmoid notch separating to the coronoid. Go back down to the sigmoid notch, go up to the condyle, and view the entire condyle, making sure there's no fractures. At this point, I would consider our view of the axial view of the mandible finished and no fractures identified. As I mentioned before, the axial view is the most crucial view for almost all fractures, and it's rare that you won't see a fracture on the axial view but will then find it somewhere else. However, because it is possible, we always make sure to look at the coronal and sagittal views as well. Now switching over to our coronal view, we can see the mandible from a front to back perspective. As you can tell right away booting up the scan, I can see we're heading into the spine and vertebral processes. So immediately I'll go to the other side of the scan, scroll all the way to the other side. That way we'll be approaching the face from in front of the face, going deeper, as explained in the introduction video. So since we're looking at the mandible, we'll continue scrolling through the scan until we see the beginning of the frontal side of the mandible. As you can see, we can see our mandibular incisors starting to come into view, as well as the mandible itself. Scrolling through, right away, after the anterior segment, the mandible will split and we'll be able to see on each side. This is a great view here where you can see once again the inferior alveolar nerve exiting through the mental foramen to become the mental nerve on both sides. As a general rule, when you can see a structure or an anomaly on both sides and it's symmetrical, it's likely to be natural anatomy rather than a fracture. Once again, as stated in the axial view, once the mandible splits into two sides, it's easier just to follow one side at a time. For consistency's sake, we'll start on the patient's right side again. As we scroll back, in addition to the teeth, we can see the buccal cortex and the lingual cortex, as well as the normal lingual concavity of the mandible here. Scrolling backwards, we're looking at both cortexes and the teeth to see for any fractures. As you notice when we scroll back, the ascending ramus begins to come into view. As we keep scrolling, we're going up the ascending ramus, and you'll see the split of the coronoid and then the condyle. What you're seeing first is your coronoid. After that, you'll get to your sigmoid notch, and then you'll begin to see the condylar process leading up to the condyle. This makes sense, as from going from a front to back view in the mandible, you should see your coronoid first, and then more posteriorly, your condyle. Once again, we make sure to scroll all the way through to make sure we're not seeing any displaced fractures or break in the cortices. And once we're done with the right side, we'll scroll all the way to the front and do the exact same thing on the left side. As you're able to tell while we're doing this, everything needs to be systematic and thorough. It's important that when you're going through one side or one view, you should only have to do it once. You don't want to have to scroll at the beginning, check a little bit of the right side, come back, check the left side, check, keep going back and forth. As you can tell, you want to start at the front, go all the way back, be very thorough, then come back to the front and switch. So this time we're focusing on the patient's left side. Looking at the coronoid process and the sigmoid notch, and then the condylar process leading up to the condyle. Once again, no fractures are identified. Moving on to our sagittal view, it's always difficult to tell once you start scrolling if you're on the left or right side. Sometimes it's obvious based on the patient's dentition, or prostheses or implants, or if a known fracture is on a certain side. But often, the easiest way is when looking at multiple views, for example, the axial view. If you scroll down on the axial view and you know this is the right side of the patient and this is the left side of the patient, you can use your 3D cursor to click anywhere on the right side of the patient, and then you know that you're starting on the right side here. Alternatively, if you were interested in the left side, you could always click on the left side of the patient and then scroll through going to the right side. Personally, I don't think it matters if you start on the left or right side, as long as you know which side you're on. So, scrolling through the sagittal view, the first thing that should come into view is the condyle. It's easier to see the anatomy of the sigmoid notch, the coronoid, and the condyle from the sagittal view, and now you can appreciate what you were seeing before. For example, when we were on our coronal view starting at the front of the patient and heading backwards, now it's easy to see that we would hit the coronoid first before viewing more posteriorly the condyle. Also, you can see the entrance of the inferior alveolar nerve at the lingula very clearly here and can actually track the nerve all the way down. So, as far as reading the scan for fractures, you would start on one side and you would look at your condyle first, then your ascending ramus, your sigmoid notch, your coronoid, the rest of the ramus, scrolling down, going towards the angle of the mandible, and now the body of the mandible. It's also very easy to identify fractures in the teeth in the sagittal view, as you'll be able to see them from top to bottom. Scrolling through, we can see here our mental foramen once again. And as we keep scrolling, it'll curve around the mandible towards the other side, and we'll continue to look back. Now once again, we have the mental foramen on the other side. We're going posteriorly again. And now we're on the other side. We can check out the other side's coronoid, the ramus, and the condyle. Once again, always making the scroll completely through. Although it'll be obvious once we start looking at some fractures what exactly you're looking for, as I mentioned before, any breaks in the cortex is a red flag and should warrant further investigation. The last thing we need to touch on is multiple views. As I said before, combining views like axial, coronal, and sagittal views is very helpful. For example, if, when scrolling through the axial view, you weren't sure about this, you weren't sure if it was a mental foramen or a green stick fracture going through one cortex only, you could take your 3D cursor and click on it, and right away in the coronal view you'll be able to see it's symmetrical, it's below where the premolars are, and just knowing your general anatomy, this makes sense that this would be the mental foramen and the exit of the inferior alveolar nerve.